Welcome back, everyone. I'm Steve,
And I'm Scott.
and together we're Meat Popsicles, broadcasting from Apple Valley, California. It's cold, man.
Not me, man. I'm in a comforted, air-conditioned 68-degree room. So you're sitting
He gets the
outside in 34
geriatric
degree,
treatment.
34 degree
Yeah,
wind chill. So
yeah, it
what's
is
hers?
cold. So we are Backyard Musings. We are the Science and Technology channel. Got a really interesting segment for you today. Heart disease is the world's leading cause of mortality, comprising 32% of all deaths. Not guns, heart disease. But that doesn't mean people are powerless against the condition. There are some steps they can take to help reduce the risk. In addition to adopting healthier lifestyle habits, getting a specific screening, the coronary artery calcium score, CAC, can help detect early signs of heart disease, experts say. Would you like to know more?
Okay, here we go. The CAC score is a specialized CT scan that measures calcium buildup in the walls of the heart's arteries, according to board certified cardiologist Robert Siegel, a founder of Manhattan Cardiology and co founder of www.labfinder.com. Quote, this calcium points to the accumulation of plaque that can cause heart disease, he told Fox News Digital. The higher the score, the more calcium in the arteries, thus a greater likelihood of a heart attack, stroke, or other cardiac issues. Not good.
Yeah, we all know about plaque buildup in the arteries that causes stroke. We know about that.
Correct.
So finally, there's a test to tell us what our plaque is. A calcium score of 0 indicates no coronary calcium and places the individual at a very low risk for heart disease. A calcium score greater than 400 indicates a high risk of heart disease, according to Dr. Bradley Surwer, an interventional cardiologist and chief medical officer at Vital Solution, an Ingenovis health company that offers cardiovascular and anesthesiology services to hospitals. The scan images are processed using specialized computer software, okay, like an AI, producing what is called an Agatston score. Did I say that right? Agatston? This
Sounds right.
computer algorithm evaluates how much calcium is present and calculates a number or score, Sewer said. The CAC score is obtained with a rapid low dose CT scan, said Maryland based Sewer.
Okay, so I'd like to meet somebody that has a 0 score. What does that mean? They're drinking water, and that's it, right?
Maybe.
Water.
A
Um,
vegan. A vegan might have it.
okay. The CAC score is a non traditional risk factor that isn't as widely known as more routine screens like cholesterol checks or blood pressure measurements, according to Siegel. Quote, still, awareness is rising as more research shows how valuable it is in forecasting cardiac disease, he said. The results, the result of the scan can help people take charge of their cardiac conditions, experts say. Another quote, it's helpful because it helps identify heart disease early, even if you have no symptoms, Siegel said. This allows for preventative steps like lifestyle changes or medications to lower your risk. Makes
Yeah.
sense.
If the CAC score is 0, Segal recommends keeping up good practices and continuing to track risk variables. Quote, a low score indicates mild plaque. Therefore, lifestyle changes such as improving diet, exercising, and lowering cholesterol will help, he said. A high score indicates that you should work with your doctor to reduce your risk, maybe with statins. Generally, if a CAC score is 0, there is little need to repeat the study for 5 years, according to Surwer. For those with an elevated calcium score, there is limited data on the benefit of repeat testing. For those with an elevated score, these patients should discuss their individual cases with a trained cardiologist to determine the need for any further testing, Surwer advised, and if they're going to die.
Well, and I would think you don't have to do it for 5 years, and that's if you don't change your lifestyle, right? If you start
Yeah,
eating a lot of red meat or injecting a lot of calcium. I mean, not even just injecting calcium, right? I mean, if you if your body, I think if your body doesn't get enough calcium, it'll take that calcium that it is getting and start to store it. And that's where you get like kidney stones and osteoporosis and all that kind of stuff. So not
It
that
also
I'm a,
make it
not that
also
I'm
makes
a
me think that if you don't need it again, it's probably really expensive.
yeah, that would be something to look into as well. So this test is used in combination with other risk factors such as cholesterol, blood pressure, and diabetes to determine who needs aggressive medical therapy for primary prevention of heart disease. Quote, the earlier we can identify those at higher risk of heart attack, the earlier we can start them on proven therapies to avoid bad outcomes. That was Sirward quoting that. Again, going on with the quote, while we have no data that shows merely performing this test makes you live longer, knowing who we need to treat aggressively and knowing when we can delay or avoid medical therapy is very important. Makes sense, I guess.
Yeah, it does make sense. In terms of potential risk, Segal compared the CAC scan to a mammography, noting that it's fast, non-invasive. Well, mammograms are not non-invasive. That my wife tells me they hurt. Uses only a small amount of radiation and does not involve dye injection. Quote, it only gauges current calcium and it cannot identify soft plaque that's not solidified, he noted. Segal also cautioned that a zero CAC score does not imply zero risk, particularly in cases of diabetes or smoking, which are additional risk factors. Quote, it's a useful instrument to be coupled with other health evaluations, he said.
People interested in getting the CAC score should start by seeing a cardiologist. Those between the ages of 40 and 70 who have risk factors like high cholesterol, high blood pressure, or family history of heart disease are usually advised to get the scan. That's according to Dr. Siegel. I guess he's a doctor, right? Dr. Siegel?
Yeah. Yeah.
Silver recommends that patients discuss individual risk with their primary care provider to determine whether the test will be helpful. Quote, we don't currently have standardized guidelines for testing or frequency of repeat testing, he said. Okay.
The test can be performed in most radiology departments. For those who are only getting a coronary artery calcium score, there is no preparation required, Sewer noted. Quote, there is no need for IV contrast, so there is no need to fast or obtain blood work prior to getting this study. Coverage for the CAC test varies based on individual insurance plans. Quote, some plans consider this test elective or investigational and therefore won't pay for it, Sewer noted. Medicare currently does not cover the cost for asymptomatic people for risk stratification purposes.
Yeah, you know why? Because Medicare does not care.
Yeah, they don't.
They don't care. So
No.
that was fresh out of the mouth of somebody who I signed up with when I signed up for Medicare. So she just said, yeah, because I told them, I said, I'm already insured. I got another insurance company through my wife. Medicare doesn't care. So too bad. That's all we got.
Coronary artery calcium test. Ask your doctor if you've got these high risks and if you're in that age group.
Yeah, sounds like a good deal. I mean,
Hopefully it's not expensive.
Have you ever known anybody that's got a one of those full body scans to detect like cancer and that kind of stuff? No, me neither. I remember when those first started being popular. They used to advertise them on the radio. I wonder if they're still popular and if you can still get those things. So, but anyway,
I've donated my body to science after I die so they can poke and prod and study. Maybe they'll find out the mysteries.
What are they going to study?
Everything, whatever, you know.
You mean
whatever?
Are you saying you're a donor, or are you saying you donated your body to science?
Yeah, donate my body to science. Poke it and prod it, cut it, study it, whatever.
Not that I plan on doing that, but how do you do that?
No, I can't give away that.
Oh, you can't reveal that?
I can't reveal that. No.
All right. Well, stay tuned, folks. Maybe he'll slip up between now and the time of termination. So, okay. You guys.
All right. Thanks, folks. We'll see you later.
Thanks. See you later.